Booster shot is an additional dose of vaccine given after the protection provided by the original shots naturally decrease over time, and the booster is designed to help people maintain their level of immunity longer.
And here in Indonesia, the government is planning to roll out booster shot distribution starting in January of 2022. It is predicted that over 50% of the public will be fully vaccinated by that time. Booster shots are prioritized for those that are prone to COVID-19, such as elderlies and those with congenital diseases. For more information about booster shots, we're now connected with the spokesperson for the National COVID-19 Vaccination Program, Ibu Dr. Siti Nadia Tarmizi. Good morning, Bu Nadia. Thank you for joining us today.
Good morning, Bu.
Good morning, Paul. Good morning, Shannon.
Good to see you again. First of all, can we find out who is actually eligible for all the booster shots at the start of the rollout of next year?
Yeah, in fact, currently we haven't got into the decision, how we move forward for the booster shot, because there is several things that we need to prioritize, especially at the end of this year. The first one is to accelerate the full vaccination for like 30% for the first dose and then like 50% for the second dose. And lastly, of course, currently today we do the starting the vaccination for 6 to 11 years old, which means that we start to provide this vaccination this week for the certain districts and the cities. So with these two conditions, we haven't yet into finalize the decision about the booster and then how we move forward for this booster shot. But currently, we already plan to have booster, especially for elderly, as the second group priority that been recommended to receive the next for the booster after the health workers.
Okay, Bu Nadia, can you please explain to us the vaccine that has been given to the children? What brand was it? Is it Moderna or Pfizer or maybe Sinovac?
And what is the dose going to be like? Because we've also heard that children might be getting a smaller dose than adults.
Yeah, currently our FDA has been approved only for Sinovac vaccine that eligible to give to the young children. So it means that we will use a Sinovac as our vaccine to provide for these young children. And regarding the dose, it's similar to the teenager or adult. It's like 0.5 milliliters with two shots with the range of 28 days. So it's not really different from the teenager or even from adult.
Bu Nadia, since we've learned about this Omicron variant and since the government has made a decision to vaccinate younger age groups, how does this affect the supply and logistics of vaccines? Because the original plan would be to fully vaccinate as many as possible until we reach herd immunity. But obviously that has changed now that we're trying to get boosters out there as well. Does this change the supply chain of the vaccines that we have received and are planning to receive in the upcoming months?
Yeah. Of course, in terms of facing the pandemic situation, we always need to adjust what the current action that we have been taken. Previously, we did not expect there is a new variant since the Delta variants keep mutation and they almost like 45 variants in terms of Delta variants itself. Even in Indonesia, we have found like 22, 23 new variants of variants Delta. So we really did not expect to have a new variant such as like Omicron that we just hear about. Of course, with that condition, it makes us to adjust again our strategy in terms of facing this pandemic, because currently we know that the situation of COVID-19 is very in good condition. Yeah, so we can see that our positivity rate keeping decrease, and then the number of positive cases is now below than 300, and the death case is less than 10 cases per day. So many things that have been we are
Adapt.
giving the relaxation for community activities, yeah, including, for example, like we do have activities for the economics, or even for social interaction in the community. So with that, of course, we need to see what will be the best scenario again in terms of the new condition of this current pandemic. And of course, one of the decision, once we know that at the end of the November, when FDA has been approved to provide Sinovac to give for the young children. Of course, we need again to calculate the number of the vaccine that we need. The current vaccine that we already secure is only for 280 million target, which means that it is up to 12 years old. Yeah.
Right.
So once we have additional target, 6 to 11 years old, which means that we need to get more additional vaccine. Roughly is like 58 million until to 59 million.
Yeah.
So we need again to confirm about this availability. Once we got the confirmation, now we start to provide this vaccine. Of course, with the certain condition that we would like to have priority on this Sinovac to give to these young children. And we really like to see more other groups are not choosing or are not use Sinovac vaccine for them, because we would like to prioritize this vaccine to these young
Sure,
children.
that would make sense as well. And, obviously demand is going to increase continually for vaccines as boosters roll out, younger people are getting it. But if anything, those numbers you mentioned before, Ibu Nadia, proves that vaccines do keep those fatality rates down and less hospitalizations. So we hope it continues to stay that way.
Yeah, that's true. And Abu Nadia, you also stated that this virus had mutated several times. Even in Indonesia, there are 20 to 40 types you mentioned. So back to the booster shot, who can actually get it, and what are the plans now? Maybe you can share with us about the plan and the schemes that may be implemented in January 2022.
Yeah, we have planned to provide a booster, especially for elderly, because we know from the scientific information that the vaccine, in terms of time, they will decrease their efficacy. Besides that, with the new variants that have been affected to the vaccination, of course, one of the impact of the new variant is they are reducing the efficacy of the vaccine. And we aware that, especially in elderly, because of their age, because of their frailty, of course, their immunity is not as good as the younger people.
Yeah.
So that's why within 12 months, maybe, because mostly the elderly starting getting vaccination around March 2021. So it means that we need to evaluate whether their antibody has been very decreased, and then in terms of that, we need to provide the second shot of the COVID-19 vaccine.
Yeah, that would make sense, right, Bu Nadia? Because they were the first ones to start getting, along with the medical workers and healthcare workers and frontliners. It was the elderly that got their shots first. So they should technically be in line to get their boosters first, because they would need it more than others as well. So when we talk about vaccine brands, we've heard a lot about being able to mix and match. Is it the same way, or the case may be here in Indonesia as well, that it doesn't really matter about the brand, the government will decide as to which, but most of them can be mixed and matched?
Yeah, we heard from the last stage meeting in 12 December that they mentioned that people who got the vaccine under live attenuated vaccine, which means like Sinovac or Sinopharm, they should get a booster. And one of the condition is we take this recommendation that we will not only provide elderly who got the Sinovac vaccine, but all elderly who got any brand of vaccine should get the third dose, because of course the reason that I have explained before.
Yeah.
And this means it might be some elderly who already have, for example, they have 2 doses of Sinovac, they might able to receive another type of the vaccine, for example, like Moderna or Pfizer or Johnson and Johnson. So it means that the heterolog or the homolog will be applied in terms of providing the third dose for this elderly. But of course, again, the Itagi and the FDA should again to discuss further to provide this recommendation for the government so we can start provide this shot to this elderly.
Okay. Bu Nadia, if we're not eligible to get the free dose of booster vaccine, can we pay for the vaccine? Because there are some rumors that you can actually get your pay vaccine in the January 2022. How about that?
Yeah, I think this is not really a final decision. Yeah. So
Okay.
once of the plan in terms of providing this third dose, of course, again, the consideration is the availability of the vaccine itself. While we are still concentrate in provide the complete dose for the rest of 218 targets, and of course additional these young children 6 to 11 years old.
Okay.
So with these 2 conditions, of course it will be like very need to ensure, yeah, the stock of the vaccine is available to cover that target. While for this third dose, we really need to prioritize, because the vaccine it will be not enough for everybody. So that's why there is 2 possibility. First, of course, for the one who are a vulnerable group, such as like elderly, and the one who receive our social insurance, what we call it JKM, the one that will be covered by the government. The other target or the other participants that might not include those 2 criteria, they might access this the third booster by paying for themselves. But again, we need to ensure the availability of the vaccine
Sure.
in the country.
Well, as the government continues to consider the availability of vaccines, Lapor COVID-19 suggested for the government to perhaps reconsider the distribution of booster shots and instead focus on fully vaccinating all Indonesian citizens. Now, obviously, Bu Nadia, there is plus and minus to each of these cases, and we won't really know. I mean, it's very hard for us to guess what would be the best course of action. So could you outline for us perhaps what would be the plus and minus to either approach?
Yeah, in terms of tackling the pandemic, we know that we need to provide this complete vaccine for the current target, which means that at least 70% of the population.
Right.
That's why we are concentrate to those who not yet ever get any vaccination. So which means that we complete this 280 target, adding with the young children that we currently start for the vaccination. And of course, for the third dose, it will be like additional shot, yeah, for the one who already received it. So which means that the one already received, they already have some protection, there's some immunity. So it means when they are facing with the COVID-19 infection, they already have some memorized and they have already some antibody that will be fight with this virus, and it will be reduced their severity and the death possibility. So that's why the most important is first we provide the complete dose for those who's not yet got any vaccination.
Still the
And then the
priority.
second one, if we think that we need to get or to provide the booster, we need to choose the really vulnerable group
Yeah.
to get this vaccination.
Right. Okay. So, Bu Nadia, thank you so much for this
Thank you, Bu
update. We're
Nadia.
very happy to hear that there's going to be boosters starting next year. We do know that that was coming, but we're also very happy to hear that kids, as of today, between the ages of 6 to 11, have started receiving vaccinations via 106 different districts, if I'm not mistaken. So we hope that the rollout continues
Yes.
smoothly. Thank you, Bu
Thank you,
Nadia.
Bu
As you
Nadia.
continue on with your day, we hope that you stay healthy and stay safe.
Stay
And we look
safe.
forward to talking to you again really soon.